Thank you very much, Mr. President. Thank you, ladies and gentlemen of the Senate. I rise today in opposition to the House Bill 33. I also must take this opportunity to certainly thank the members of the Finance Committee, starting with Senator Dolan and his leadership, certainly to Senator Sykes, certainly to the policy staff, to Ray and to Teresa, certainly deserves for their due diligence and their hard work. Want to thank Governor DeWine and his staff and all of those that came to the committee. We recognize in this body, and we should recognize it, that the budget process is extremely complex. But we rely on hundreds of advocates from across the state that have made their voices heard by reaching out to their legislators through correspondence, phone calls, their advocacy, but most of all to the citizens who provide countless hours of testimony throughout this process. I think Senator Sykes spoke eloquently to that, and all of us, and really thanking the citizens. They have families, they work every day, all of the folks that came down, that their voices are critical to this process and essential to our decisions, that our decisions never should be made in a vacuum or a silo. Want to certainly thank LSC for their brilliance, for their dedication to helping us move this process along. But we have a responsibility to create a state budget that properly serves all 11.7 million people in Ohio. There are real concerns that this version of the budget does not do that. Instead, it removes key provisions, key investments in our families, for our families and our children, but in particular, changes to SNAP, to child care and Medicaid are deeply troubling by my constituents. As it has been highlighted by my colleagues, this version of the bill also creates significant policy changes of great impact, which have not been heard in the House and have not had public testimony as part of the budget process. Concerning policy changes we made that further restrict local control without any input from our municipalities, cities and townships would be limited in their ability to have any local control over tobacco products. Additionally, new tax policies would exempt stock options and deferred compensation from municipal taxes. These decisions were not made in collaboration with our local governments and merit significant further discussion outside of the budget process. According to the state of Ohio, 13.9% of Ohioans, over 1.5 million people, live in poverty. These budgets do not fully use Ohio's resources to give ladders of opportunities to families and children living in poverty. We know that 1 in 8 Ohioans aren't always able to afford to put food on their tables. Food prices has risen beyond wages, and many Ohioans don't know where their next meal are going to come from. Provisions affecting SNAP, food banks, and school breakfast and lunch included in this bill will not adequately serve needing Ohioans, particularly our children and our seniors. Each of the 673,000 Ohioans that receive SNAP benefits have seen cuts in their benefits in the last 3 months. This program fills a vital gap in food security for our families, children, and seniors, and helps hardworking Ohioans to put food on their tables. They are Ohio taxpayers as well. In Ohio, more than 64% of SNAP participants are families with children. Since the first Senate version of the bill, the most devastating changes with SNAP programs have been removed. A new requirement has been created for SNAP participant ID cards that will physically burdensome for JFS. Participants' EBT cards will not be required to include photo IDs and a fraud reporting number. Less than 0.2% of accounts are associated with fraud. This, among other deferential rules, are gravely concerning and are a disservice to the hundreds of thousands of working families who rely on this program to put food on their table. This budget also fails to care for senior Ohioans who increasingly face hunger at alarming rates. Amendments were introduced and rejected which have raised the minimum SNAP benefits for 70,000 seniors from $23 to $50 per month. With the rising cost of groceries, $23 is not enough to ensure all Ohioans have adequate and nutritious food. When 1 in 8 of our constituents in Ohio are going hungry, it is time to act. This version of the budget also gives inadequate funding to the Ohio Association of Food Banks in a time of extreme increases in demand and food prices. The association provided take-home groceries to nearly 3.2 million Ohioans between April the 14th and May 7th of this year, serving 31.9% more people than in the same time last year. Nearly 60% of Ohioans they serve are children or older adults. Food prices are increasing not only for us, when all of us go to the grocery store, but for the food banks as well. It is imperative that we restore funding to $50 million per fiscal year. Flat funding this critical program amidst increasing needs and increasing demands during a budget surplus, not something that we ought to consider. I am also disappointed that the city did not further expand free breakfast and lunch programs for Ohio students. The first step to a quality education is ensuring our students have their basic needs met, and too many of our young people go without it. Amendments were introduced to expand free school breakfasts to all of our students, free school lunches to all of our students to increase access. They were not accepted. As we experience a historic budget surplus, it is time to ensure we are using our resources to care for Ohioans in need. Governor DeWine's budget included many critical strides we must take to protect the vitality of those most vulnerable among us. He introduced critical provisions to help children, seniors, and the hungry, included publicly funded child care expansions and programs serving seniors. After hearing the diverse voices of partners advocating for expanded access to child care, I am disappointed new measures were not fully implemented into this budget. And of course, as many of you know, and my colleagues, many of them in this room, I spent over a year on the publicly funded child care study committee, where businesses, families, and communities all call for substantial increases in eligibility. The Senate cut initial eligibility for child care, which means about 15,000 families would not have the access to needed care compared to the governor's and the House budgets. It is strongly believed that these proposed raise of only 3% is not enough for families, children, and our workforce. According to Groundworks Ohio, the current infant and toddler child care crisis is costing Ohio an estimated $3.9 billion in lost earnings, productivity, and revenue. We also missed an opportunity introduced by Governor DeWine to issue $150 million in upper child care scholarships to families working in critical care occupations. We know that investing in our littlest Ohioans is the right thing to do, not only for our families, but for our workforce. The governor and the House created critical investments in infant and maternal health that were removed in the Senate. Ohio has some of the worst infant mortality and maternal health outcomes in the nation, and it's already been stated, and we say this continually. But all of us know that 2.6% of African-American children die at rates higher than other children. Any child dying is too many. We cannot ignore this problem at the expense of tax cuts. The lives of our mothers and our children are at stake. This budget cut many significant and needed Medicaid changes for young families, including removing the Medicaid expansion for babies and mothers under 300% of the federal poverty level. The bipartisan proposal to cover doulas services under Medicaid was also removed. Other cuts from the House version that will harm families include reductions in investments to healthy beginnings at home and programs to support safe housing for pregnant mothers. I'm going to conclude. And it'd be disingenuous to note that there has not been changes in the Senate that are positive, including the mental health, and we've talked about that, increased payment rates for those caring for the most vulnerable, important health initiatives, a ban on some flavored narcotic products, some investments in housing and workforce in housing in Ohio families. We need to do more in that area. Certainly there has been some work in this budget regarding intervention and prevention initiatives that are so critical and so valuable. So, ladies and gentlemen of the Senate, I urge you to consider whether this proposed budget is one that truly serves all Ohioans. Because the simple fact is, and we've said, that all taxpayers matters. The vulnerable, the marginalized, all of them matter and deserve input into our work. Thank you very much, Mr. President, for the opportunity to speak today.